In 2017, I didn't care if I continued to live. I was in the throes of a major depressive episode, and it took me about 2 years to crawl out of it, but I chose purpose over pills. Hi, if you're new to my channel, I'm Dr. Brian, retired physician, now functional health coach, and founder of Health Without Risk. You may have seen a post floating around X recently that says depression is not a mental illness. It's a warning that you're not fulfilling your full potential. When I first read that, my decades as a physician flashed. I know how dangerous it is to dismiss clinical depression. But my experience as someone who lived through major depression and now as a functional health coach tells me the spirit of that message is critically important. I can tell you exactly why that warning rings true for me. I spent my life fulfilling a dream, becoming a doctor. Far from my blue-collar roots, I watched Marcus Welby, MD, as a kid. That's what I wanted to do. When systemic and personal challenges unjustly stripped that career and identity away, the resulting emotional trauma led to a major depressive disorder, complete with the idea that I no longer cared if I continued living. This wasn't just sadness, it was a profound life-altering crisis. The way I climbed back out, I came back to my roots and surrounded myself with family and friends I had known my entire life. I did not reach for psychiatric medication. I listened to the warning. I channeled that pain into creating a new purpose, my functional medicine coaching approach to health, so I could stay relevant and continue helping people searching for answers deeper than the narrative that has become our current healthcare system. My personal recovery validates part of the post. Loss of purpose can trigger devastating depression, and the renewal of purpose can be the most potent medicine. But as a doctor, I've seen the need for pharmaceutical intervention. It can be a lifesaver. But here's the major shift that concerns me. When I was in training, antidepressants were intended as a short-term bridge, maybe 3 months or so. The idea was to quickly lift the patient out of the acute crisis so they had the energy to do the real work, therapy, finding structure, and refocusing their life path. 40 years later, that temporary bridge has become a chronic lifestyle. I know people who have been on the same antidepressant medication their entire adult lives. That tells me we stopped listening to the warning. We treat the symptoms, but we never fix the underlying disconnect, the underlying inflammation, or the underlying lack of purpose. Here's my message after living through all that. Clinical depression is real, and sometimes medication is necessary to stabilize someone. But before we commit a person to a lifetime of managing symptoms, remember that depression is also a powerful signal demanding change. If you are struggling, please seek professional help, but let the goal be, what is the warning your depression is giving to you? How can you use functional health strategies, addressing your gut, your nutrition, your purpose, to solve the problem, rather than just masking the symptoms for the next 40 years? Don't ignore the signal, use it. If this resonates with you, like and share this video. And don't forget to subscribe to or follow Health Without Risk, where we explore options for better health that don't involve a lifetime of gaslighting and prescriptions. Thanks for watching. Bye.